Just a few months ago, President Trump solemnly declared that he would impose tariffs of up to 20% on Chinese imports to punish China for failing to stop the flow of fentanyl into the United States. However, on July 16, he told reporters in the Oval Office of the White House, "I think China has been helping us. They are taking great steps." Is this 180-degree turn a great diplomatic victory or a carefully choreographed political show? To understand all this, we first need to figure out what fentanyl is. Fentanyl, in its legitimate form, is a powerful synthetic opioid. Its analgesic effect is 100 times that of morphine and 50 times that of heroin. In medicine, it is an angel for patients with advanced cancer and patients after major surgery and can effectively relieve severe pain. But here's the catch: it's a slippery slope. Overuse leads to dependence, and dependence can quickly spiral into addiction. This isn't just about recreational drug use, it's about a public health crisis driven, in part, by the overprescription of opioids. For years, pharmaceutical companies pushed these drugs hard, downplaying the risks and raking in profits while communities paid the price. The real danger, though, comes from illicitly manufactured fentanyl. This stuff is often mixed with other drugs, like heroin or cocaine, without the user's knowledge. Because it's so potent, even a tiny amount can be lethal. This is why we're seeing overdose rates skyrocket. While overdose deaths saw a decline in the United States for the 12 months ending in June 2025, there is still much to be done and a long way to go. Now, here's where the international intrigue kicks in. Much of the illicit fentanyl and the precursor chemicals needed to make it originate outside the United States. China has been identified as a major source of these precursors, which are then often trafficked through Mexico by cartels before entering the US. This has led to a blame game, with the US pointing fingers at both China and Mexico for failing to stem the flow of this deadly drug. The US State Department, while acknowledging significant steps by China, stated that more could be done. Enter tariffs. The Trump administration has repeatedly threatened or imposed tariffs on goods from these countries, arguing that it's a way to pressure them into cracking down on fentanyl production and trafficking. The idea is that by making their goods more expensive, we can force them to take action. He imposed a 20% tariff on Chinese imports in response to the fentanyl crisis. But here's the problem with tariffs: they're a blunt instrument. They don't just hurt the countries we're trying to pressure, they also hurt American businesses and consumers. When tariffs are imposed, American companies that import goods from those countries have to pay more. Those costs are often passed on to consumers in the form of higher prices. It's like trying to solve a problem with a sledgehammer when what you really need is a scalpel. According to the Trade Compliance Resource Hub, the fentanyl tariffs on goods from Canada, China, and Mexico were temporarily blocked by the Court of International Trade, but that decision was stayed, so the tariffs remain in effect pending appeal. Economists have repeatedly warned that tariffs can lead to job losses, reduced economic growth, and higher prices for everyday goods. So, while the intention might be to combat the fentanyl crisis, the reality is that tariffs can be a self-inflicted wound. The tariff on Chinese imports to the US now stands at 41% 10 reciprocal plus 20% fentanyl plus 11% starting point, and China also retaliates with a 27.5% tariff for US imports. But it should be noted that China views the issue as a US problem stemming from domestic demand, not Chinese supply. Now, for the uncomfortable truth. While it's easy to point fingers at other countries, the US needs to take a long, hard look in the mirror. The fentanyl crisis didn't materialize out of thin air, it's rooted in our own domestic issues. We have a healthcare system that often prioritizes profits over patient well-being, a history of overprescribing opioids, and a lack of adequate addiction treatment and prevention programs. Before we start slapping tariffs on everyone, we need to address these fundamental problems at home. We need to invest in evidence-based treatment and prevention, expand access to naloxone, a drug that can reverse opioid overdoses, and hold pharmaceutical companies accountable for their role in fueling the crisis. We also need to address the underlying issues that make people vulnerable to addiction in the first place, such as poverty, lack of opportunity, and mental health challenges. Critically, we need to embrace harm reduction strategies, meeting people where they are to prevent overdoses and connect them to care. So, what's the solution? It's not just tariffs. It's a multifaceted approach that combines international cooperation with domestic reform. We need to work with China and Mexico to crack down on fentanyl production and trafficking, but we also need to address the demand for these drugs here at home. This means strengthening law enforcement efforts, improving border security, and using diplomatic pressure to hold countries accountable. As Ryan Hass at the Brookings Institution notes, Washington needs to publicly recognize Chinese steps and show responsiveness to Beijing's own concerns. And here's a bit of irony. Trump, who initially blamed China, is now claiming they are making big steps and may even impose the death penalty for fentanyl traffickers. It's a convenient shift, especially since Beijing has linked cooperation with the US on the issue to the health of the broader relationship. The fentanyl crisis is a complex challenge with no easy answers. But one thing is clear, blaming other countries and imposing tariffs isn't going to solve the problem. We need to address the root causes of addiction here at home, work with our international partners to disrupt the supply chain, and adopt a more rational, evidence-based approach to drug policy. Only then can we hope to turn the tide on this deadly epidemic. Thanks for watching.